Hello cruel world. Today I'm going to tell you about the horrendous case of Rocky Bennett. My name is Dr. Sohom Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. So I selected this case because it's something that I am going to be writing about, or I have written in my book, In Two Minds, which will be released in spring by Sphere Publishing. More about that later. So this event actually occurred before my time, but it sent reverberations for decades within the area that I work in, the world of forensic psychiatry. And we even taught about it during our training when I was a measly, lowly little specialist registrar. So basically, it involves the overzealous restraint by nursing staff which killed a man called Rocky. He died on the 30th of October 1998. This all happened in a medium secure unit in a place called Norwich. So first question is, what is a medium secure unit? I have discussed secure units in detail in other videos. I think I did this in the Broadmoor series, so go check that out if you're interested. But basically, to be very brief, it is for offenders with a history of violence who have psychiatric illnesses. They're there for rehabilitation. Usually they come from court or they come from prison. So contrary to what you might think, low secure units are actually not that common. And there's only about 5 high secure units in the UK. So actually the vast majority of these secure units are medium secure units. Broadmoor is probably the most famous of all the high secure units. I worked there many years ago, and I've actually done a series about Broadmoor patients, including Bronson, Cray, and the Yorkshire Ripper. So I've done videos on all those people. If you're interested in that kind of thing, go check it out. Okay, let's get started. So question number 1, what was Rocky Bennett's background? Well, he was about 38 years old. He was an Afro-Caribbean patient, and he suffered from mental illness for about 18 years, and he had a diagnosis of schizophrenia. I've talked about schizophrenia in my other videos, but very briefly, it is a chronic, relapsing and remitting disorder, which means that people suffer from periods of psychosis, which are hallucinations and delusions, and it's got absolutely nothing to do with split personality. So apologies, dear viewers, if I appeared distracted just then. I kid you not, our hamster Nibbles escaped, and as I was recording, he started crawling across the floor, so I just had to stop to catch him. But don't worry, crisis averted. Let's get back to the video. So let me tell you about the background of Rocky. David Roy Bennett was nicknamed Rocky, and he was born on the 5th of February 1960 in Jamaica. Then he came over to England in 1968 to join his family, who were already living in Peterborough. His father worked as an engineer, and Rocky had 8 siblings. He worked as a sign writer for about 3 years, and then he left that job voluntarily, and then he didn't work after that due to health difficulties. Rocky was a talented footballer. He was also a good musician. He played the drums. He also was a Rastafarian, and in 1980 he set up a club for the Rastafarian community in Peterborough. I've never been to Peterborough, but I'm guessing there's not many Rastas out there. So Rocky was first referred to a psychiatrist in Peterborough in September 1980, so he would have been about 20 years old. And then in 1984 he was convicted of minor criminal offences, and then before he was sentenced, a psychiatrist wrote a report to the court which recommended that he was made subject to a probation order. So I can connect with this because it's exactly the kind of assessment that I do now as a living in my job as a consultant forensic psychiatrist. So in this case, luckily the court agreed. But in December 1984, Rocky was admitted to Peterborough District Hospital for psychiatric treatment, and he decided to discharge himself. So this was a breach of his order, and therefore because of that he was arrested and remanded and was sent to prison HMB Bedford, and then he moved around other prisons. So already I think this is a little bit unfair, because if it's part of his order then he shouldn't have been allowed to discharge himself. They should have referred him to court at that point rather than him get rearrested, if that makes sense. So at that time, he was also diagnosed with cannabis-induced psychosis, though a bit later on in July 1985, Rocky was diagnosed with schizophrenia for the first time, and then he went back to a psychiatric hospital. I've done episodes on drug-induced psychosis, I've done episodes on schizophrenia, but very briefly, they're similar in some ways in their presentation in that they both involve periods of psychosis, but drug-induced psychosis, or in this case cannabis-induced psychosis, obviously happens only after heavy cannabis use. It tends to come on quicker than periods of schizophrenia, and it tends to last for a shorter period of time, usually days. Whereas schizophrenia, you do have periods of psychosis, but they come on slowly, they last longer. Not in somebody who doesn't use drugs, who's got schizophrenia, they still have psychotic symptoms. If you've got schizophrenia and you use drugs, then you can flip into psychosis with drug use. So you can have both. You can have cannabis-induced psychosis on the background of schizophrenia, if that all makes sense. If you don't know what I'm talking about, tell me in the comment section below and I will sort myself out and explain it better in another video. Anyway, going back to Rocky's background, there are reports of unprovoked attacks and assaults by Rocky on both staff members and patients. So I think it's only fair in the interest of balance to highlight that he was potentially at times a dangerous man. So when he went back to psychiatric hospital, he went to the Norwich clinic in Norwich, which is a medium secure unit, which is the place that he later died years afterwards. So I think that's significant because now he's in the forensic psychiatry system, so he's seen as an offender from prison as opposed to the general adult psychiatric patient. So I'm not going to go into a lot of detail about Rocky's mental health history because it's quite long and it's convoluted, and if you're interested, then it will be, all the details will be in the link below of the report. But I will briefly summarize by saying that he had multiple hospital admissions, he had lots of different short prison sentence, and it seems from what I've read that Rocky's mental state was variable. So he was definitely unwell at times, but he was also lucid at times, and that's quite typical of schizophrenia. So by its nature, schizophrenia is a relapsing and remitting disorder, so people are well and unwell throughout most of their lives. And I think it's only fair that even though Rocky was violent at times, he was also charming at times. Right, let's get down to business. What happened in the evening when Rocky Bennett died? So what happened is he'd been in an incident with another patient who was white, and during that incident each man struck out and punched each other. But then Rocky was the recipient of repeated racist abuse from that white patient. So it felt like he was provoked over time. Then after this incident, Rocky was moved to another ward, and in that ward he hit a nurse. So after that he was restrained by a number of nurses and a struggle developed. And Rocky was taken on the floor and he was placed in a prone position, which is basically lying down but with his face flat on the floor, and the restraint was protracted, it was prolonged, it was for over an hour. Another really relevant factor is that Rocky was given a dose of medication above the recommended limit, which might have decreased his breathing rate, which makes him more susceptible to die as he eventually did. So that's the detail. So what did the inquiry into Rocky's death conclude? So as I said, the link's in the description if you want to read it in more detail. I'm just going to summarize it. So this is the inquest report. It was released in December 2003. To summarize, it says that his death was due to institutional racism within the mental health services. So this includes the fact that there were no repercussions for the white patient who Rocky had been in an altercation with, even though it was said that the white patient provoked the fight. And there were also many institutional failures, including that there was no real attempt to engage his family in his treatment. Even though he'd been treated for 17 years on and off, there was no attempt to really get their opinion, get their feedback, get their input, which is completely inexcusable. He was also not treated by the nurses, according to the report, as a rational human being, but as a lesser being. I'm quoting there. And there was no indication that his racial, cultural, or social needs were adequately attended to. There was also a highly insidious form of racist abuse, which likely contributed to his desire to kind of retaliate against the system. Further, on top of all of that, Rocky was receiving 3 antipsychotic drugs, all of them in excessively high doses, when only 2 antipsychotic drugs were authorized. So what that means is that the consultant psychiatrists, so I used to do this myself when I worked in secure units, we write the prescription charts for our own patients, but for every patient you have to have a SOAD, that's a second opinion appointed doctor, so a completely independent doctor comes into the hospital and they assess the patient, they assess the medication charts, and they give you permission to use certain medications at certain doses. The reason for that is exactly for this reason. It's to stop patients being over-medicated, because antipsychotics at high doses are life-threatening potentially. So as I said before, that this is potentially relevant because it might have contributed to his physical demise. His breathing might have slowed down. So the inquiry also found that the nursing staff pressed onto his body until he couldn't breathe adequately, and this was done for substantially longer than what was safe. Back then, at that time, there was no central training for control and restraint, though a national system has been set up directly as a recommendation of this report, and it's been followed through. So since then, all staff in secure units have to do training. So for example, when I worked in a medium secure unit, every year myself and some of my peers would literally dress in tracksuits and go to mats, and we would practice like holds and restraints on each other. It's compulsory. So moving on, in my opinion, a slightly more menacing fault was uncovered during this inquiry, and that was this. The members of the family were not given, and I'm quoting, reasonably full disclosure of the relevant facts, was not only inhumane but also bound to lead to the family to suspect that there was some cover-up going on. So specifically what I'm talking about is that Rocky's family were not informed of his death until the following morning, and they were told that he died from breathing difficulties. So in my opinion, that's really stepping outside of the realms of mere incompetency. So the next question is, what are the broader racial injustices within the mental health services in the UK? So an independent review of the Mental Health Act tried to understand why a disproportionate number of people from black and minority ethnic people were detained under the Act. So the final report was published in December 2018, and it revealed that black people are 40% more likely to access treatment through the police or the criminal justice system, as opposed to, for example, your GP or presenting yourself to a psychiatrist. They were less likely to be offered psychological therapy, which is obviously less restrictive than medication, etc. They're more likely to be compulsory admitted for treatment, as opposed to being sectioned, as opposed to being a voluntary patient. They are more likely to end up on a medium or high secure ward, and they're more likely to be the subject of seclusion or restraint, which is exactly what we're talking about here. So to give you some specific figures, about 56.2 per 100,000 population of black Caribbean patients were restrained, as opposed to 16.2 per 100,000 population of white people. I have talked about restraint and about seclusion in other videos, I think, of my series about Broadmoor. If you want to know more about why people are taken to a seclusion room and what happens there, then read that. So before my final thoughts in this video, I want to really quickly welcome you to this channel. So what you're watching is a Psych for Sore Minds. I am your host. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders in prisons and in courts and in secure psychiatric units. This channel addresses a whole range of topics, from individual diagnoses to my own real life cases that I've assessed, where I anonymize the patient. I talk about high profile cases where I give my own psychoanalysis. I interview individual patients or ex-prisoners about their experiences. I also answer random questions about mental health off the internet. I occasionally dissect films. What I'm trying to say is there's something for everybody on this channel. Okay, I just wanted to share some major news for you, which is that I've got a book that will be coming out next spring by Sphere Publishing. It's called Into Minds. I'll actually talk about the case of Rocky Bennett and about 30 odd cases of my own personal cases. It's a bit more personal and autobiographical than this channel. I deep dive into my life and my thoughts and my opinions on lots of things. As you might know, if you're a regular viewer of this channel, I'm also going to be talking at CrimeCon UK. So I'll be doing a talk about 2 cases that I've assessed of real life people who've murdered family members. And hot off the press, I'm also going to do a live talk with Esther from the True Crime Podcast. We'll be talking about Jake Davidson, who you'll probably know is the Plymouth mass shooter who committed his atrocity just a few weeks ago. So before I go, I want to beg you to subscribe to this channel. Not only does it help me out immeasurably, but it actually helps fix your wonky eye, because nobody likes it. It's really distracting. I can't even tell if you're watching this YouTube video right now or if you're just looking at the suggested video bar at the side. It's that bad. Subscribe and it will be fixed. So my final thoughts about this case is that obviously it's absolutely tragic. I don't think it's excusable, not only the restraints, but the medication. But I have to say, what angers me the most out of everything is the deceit about how he died, because the other issues, the restraint, etc., are potentially negligent as opposed to intentional. But lying to his family clearly is the latter. Having said that, I think that it's only fair that I should say that we need to appreciate the staff in secure psychiatric units, especially nursing staff, who, by the way, I don't think get paid enough. Different conversation. They have to deal with this violence. It's infrequent, but it can be quite serious, these eruptions of violence. So by not reacting with physical force swiftly or by being lax in restraint techniques, the staff themselves risk serious injury. And it literally happens. Like, I've seen staff members get broken bones, black eyes, bruises. I've actually been punched in the face more than once by patients in my career. Undoubtedly, any force that should be used should be necessary, and it should be proportionate. An issue I think some cops in the States have, especially with our more ethnic citizens and brothers. I guess the point I'm trying to make is it's quite hard to measure exactly the degree of force that's needed in the heat of the moment. And I think it's only fair to say the fact that these kind of events happen in these secure units very rarely is a reflection of the risky and unpredictable patient cohort that we deal with. And the fact they happen so infrequently when hundreds of restraints occur every week without incident in psychiatric units across the country, I think is an indication of the bravery, the empathy and the professionalism of the vast majority of the staff that work there. I want this next bit to be absolutely crystal clear for all you trolls foaming at the mouth over your keyboards. I'm not just justifying the death of Rocky Bennett in any way, in any form whatsoever. It's completely inexcusable. I'm not talking about that case. I'm talking about in general in other cases, from my own professional experience, from having worked with mentally disordered offenders for over a decade. What I'm saying is it's not easy. Staff have to react quite quickly. Violence can escalate. There's a risk that they could be hurt, other patients can be hurt. That's what I'm trying to say. Okay, so I've rambled on for a long time, got a bit distracted by an errant hamster. I would like to know your thoughts about this case, about the world of forensic psychiatry, about control and restraint. Maybe you've got some experience of being treated in a secure unit. Maybe you'd like to share them. I would love to hear them personally. I finished. I just need to say, stay 𝐜𝐸𝐸, and please remember, whatever happens, do not forget. I love you.